This Guy's Garage. Like and subscribe.
You know, what we heard originally from the minister in the House of Commons was 700 people injured and hospitalized due to natural health products. Where's the reference for that? Very simply, I know I don't have any time left, but what reference is used there?
The reference was for reported adverse events to Health Canada in the last 2 years. So there were over 1,000 reports that we received of adverse reactions that were potentially linked to.
I guess where was it though? Because I've searched, I can't find it anywhere.
So that's available if you look at the Health Canada the database. We actually put those out publicly, but you would have to do a search for adverse events and natural health products. And so we've done that and compiled those.
Would you table that with the committee, please, Dr. Sharma?
We can see what the reference specifically. We can provide the reference, and then again, this is publicly available information, but we can provide that.
Your comments, and you talked about a number of irregularities being identified, and you gave certain numbers, and I think it was sort of Dr. Sharma sort of touched on about the 8,000 at this point in time over the last, and that's since 2004. So that's basically 470 reactions in a year, in simple math. But my question to you is this: if you've identified that and there's a process in place, there's a regulatory process in place, what steps have you taken once you identified those to go to the regulatory process there and get answers for that?
Yes, and I'll just say that over the years, in terms of the adverse reaction reports, they have been increasing. So if you look at the last 2 years, we've had about 1,000 in a 2-year period, with again 700 or over 700 of them being serious. So it's increasing. We have more products, so it's understandable that we'll have more reports. Overall, though, that's likely a very serious underreporting, and that's the case for all health products. So I'll say that. But
sorry, I appreciate that. So we're increasing over how many products?
So that's a good question. In terms of the products that have been authorized, there would be over 200,000 products. However, we believe that potentially only half of those are marketed. There's no requirement for companies to notify Health Canada if they're marketing the products, and so we don't really have that number. We've tried. In April, we tried to do a survey of companies to get an idea of the numbers of products that are marketed, and we only got about an 8.3% response rate on those.
Thank you. And in comparison to medicine, in particular pharmaceuticals, et cetera, when we look at, for example, grapefruit being a huge impact on ticagrelor or Lipitor, how many reactions do you get on that? How many responses to that? And comparing that numbers-wise, I anticipate that you'd have a significantly higher number along those lines.
So for pharmaceutical drugs, prescription drugs, we do have higher levels, and it's in the tens of thousands. We also have a requirement for reporting, so increased reporting under Vanessa's law. We have the requirements for health institutions to be reporting those adverse events as well, and that's already shown an increase in reports. But yes, in general, there are more adverse events reported.
Thank you. So I'm just going to read here. This is a quote from what the minister said in the House. It is very disturbing that there was more than 700 cases last year where there was a serious adverse health impact, including hospitalizations. Would you agree with that?
I would say that if there's, where these products or any products are taken to help people improve or maintain their health or prevent disease. So if you have a serious adverse event that comes from that, then,
and I apologize for interrupting, but so what I'm hearing is you're not agreeing with that, or reality is we have the minister has reported on this number. You've indicated that you have records of it and the reference of it, and I'm just saying to you, can you give us an example of the 700 plus? By the sounds of it, and because I'd like to know how that research is collected and where it's stored and where it's provided to the public.
Doing surveillance of the products once they're on the market. One of the inputs into that is the adverse reactions that we get reported to Health Canada. We know those are vastly underreported for all products. We know that they're even more underreported for natural health products. We've done a pilot with poison control centers in the past, and for example, through poison control centers, in a 3-month period, they've got more reports related to natural health products than we did an entire year. So we know that's underreported. So that's not the only input in terms of looking at the safety of the products. We look at publications, we work with our international counterparts. So there's lots of information that we look at to make sure that we're
Thank you.
assessing the safety of the products.
Now, I just brought a simple sample, a very small sample of what I received from my constituents, and we all in here, and all 338 of us have received these significantly, and I have significantly more back in my riding. And they basically talk about the huge economic impact it's going to have. And these inflationary taxes that you're putting on these natural health products are going to even escalate this even more. And there's big concerns because the average Canadian, I would say to you, that utilizes or doesn't even know this is going on. And they're not going to know about it until all of a sudden, boom, it's going to be in their laps. So what economic impact have you done to show what the implications of this will have on Canadians?
Thank you for the question. We're hearing the feedback through our consultation. We're hearing the feedback from all of the affected stakeholders, and we've also received quite a large number of comments, up to about 5,000 comments through our consultation. We're taking that back. We're reflecting on the proposal we've put forward, and we'll make adjustments and do additional consultation.
So you haven't done an economic impact?
That's your time. Can you answer it briefly?
We did what we did was an assessment of what fees would need to be charged in order to support the program that we currently have and that we'd like to bolster in order to respond to the recommendations from the Auditor General that identified a number of gaps.
Thank you, Doc.
Through you, Chair, you know what, I find it interesting. These products are taxed. The tax revenue from this sector is about $2.3 billion, and you're telling me that you need $100 million more? That's insanity. How can you justify that?
The cost recovery proposal was developed based on the current costs of the program and the estimated costs with the improvements that we would like to put in place, improvements to inspection and to online monitoring of online advertising, and just increasing resources in those areas to make sure products on the market are safe for Canadians.
Thank you. Through you, Chair, I guess I don't understand. That means $2.4 billion to run a program. Wow. That's a lot of money. It's an exorbitant amount of money. The question, I guess the other questions that I have are really related to looking at the scale of these issues. These issues are really, I hate to say this, you know, I was a family doctor for a long time. We talked about this nebulous number of 700 people who may have been harmed. Some of them, in the words of the minister, might have been admitted to hospital. And I'll follow on with what Mr. Fergus was trying to get to. Prescription drugs, admittedly, help tons and tons of people, reduce mortality rates, make people live longer. In this country, and I'll have the reference for you if you'd like, unlike what you have not been able to provide me, is that 50,000 seniors alone were admitted to hospital last year because of prescription drugs, which you already regulate. 700 might have had an adverse event in the natural health product sector, and some might have been admitted to hospital. I would suggest to you that we're talking about unnatural regulation. That you're trying to regulate a sector which harms almost no people. It makes no sense. This is nonsensical for perhaps $2.4 billion of a budget. I can't even understand it. And also, not only are we going to regulate the natural health products sector in Canada to death, into extinction, we're going to tax it to death, but we're going to allow Canadians to continue to get medications, natural health products, online from unregulated facilities elsewhere. I can't even, there's no words for this. And I can understand why my colleague brings a small smattering of concerned citizens. You know what? This is a part of the job where people come up to each of us in public and say, how can you fight this so that I can continue to get the vitamins or the probiotics or the prebiotics that I want to have? And the scale of the issue is minuscule. And I can't even understand this. And the money that you want to recover, and we've already heard from my colleague that from the right to sell fee, which is one of the fees amongst an innumerable number of others, is up to $30 million and perhaps $100 million, because it's not simply what is sold, it's actually the licensed product, as I understand. So, the amount of money that you're asking for consumers is exorbitant, and I guess I can only attempt to understand that by, that this government has driven Canada into the proverbial poorhouse, and that we need to recover out of the pockets of Canadians another multi-billion dollars to fund the foolish spending of this government. I guess that's the only thing. And to understand that very clearly is simply to follow the money. And to ask very clearly as well that you table the number of people who are potentially having serious adverse events, and some of whom have been admitted to hospital based on some nebulous concept and some nebulous numbers that no one has been able to find. And trust me, we have searched very hard. The final thing I would say, through you, Chair, is, and there's not going to be a question here, but thank you very much. I realize I have a timer on. The issue here is really related to the fact that we're regulating something, once again, to try and tax consumers further into the poorhouse when they can't afford to feed their families, put a roof over their heads, or heat their homes in the coming winter.
Mr. Chair. Dr. Sharma, I want to go back to one of your comments that you made earlier on, and you referenced some deaths from attributed to natural health products. One was the 18-month-old toddler in Alberta. I believe it's Ezekiel Stefan that you're referring to. Isn't it true that the situation is different than what you're stating? The baby didn't pass away from using or taking natural health products. The baby ultimately passed away because the parents didn't believe in going to the hospital, and they took the baby. The baby was very sick, and they tried home remedies to try and get the baby better first. And it wasn't necessarily, the death wasn't necessarily attributed to a specific natural health product. Isn't that correct?
So again, the information that we have is the same as people have in terms of the of what was in the news. So my understanding was that they were using natural health products and natural treatments instead of
like garlic tonics,
instead of antibiotics, because the child ended up having bacterial meningitis. That's
right.
what. Yeah.
Correct, but you can't specifically tie that to one specific natural health product that was mislabeled or dangerous. Is that correct?
So the point I think there was just, and this was it was in relationship to another comment of people thinking that a natural health product might be used for something.
So what you're saying, your comments were being misrepresented.
No, I was just giving context, and so
but
the
context, if with all due respect, I believe you to be a good person. But the context that you used in your testimony today was to say that, well, a vast majority of these health products are safe. There was a tragic loss of a toddler from one. You used that as your testimony, and the reality of your testimony is you misrepresented that situation. Is that correct?
Respectfully, Chair, the idea is that we did a survey. Products are making claims against cancer. They're not allowed to make treatment claims against cancer.
But I'm not talking about cancer.
And if somebody believes that claim and takes that medication for cancer instead of treatment, then that could have serious consequences.
For
a child who has meningitis,
Ms. Sharma, specifically for this,
just trying to finish my
for this testimony, I have a short period of time. Sorry, we're just. But your testimony was.
I'm going to interrupt you for 1 second. Just your time won't stop. Dr. Sharma, you are entitled to as much time to answer the question as it takes him to ask the
Right.
question, and I will make sure that you get that, but you won't get any more. Go ahead.
So I just want to be clear and give you a chance to clarify or withdraw that statement, because in fact it is misrepresentation of this. And listen, I don't want anybody to pass away from taking natural health products. I had a natural health store back in the 90s as well too. That dates me. And so I too was on the end of saying, well, this is the next thing that's going to get you muscles and what have you. Did I know? No, I didn't. But I guess your point today was that because of unregulated, or a product being unregulated, we saw the death of an 18-month-old toddler. That was what your comments came across. And I'm just asking you to probably withdraw that, because in fact it was that the parents, their wishes were not, they didn't believe in hospitals at the time. They thought they could deal with the sickness. They didn't understand the depth and the seriousness of the illness, and they tried with home remedies to make their child. They loved their child by all accounts. I believe that they were charged with undue care, but ultimately, I think your comments were misleading. You may not intended it. It wasn't, that child didn't die because they used a natural health product. They died because they didn't get the appropriate treatment at the time in a timely fashion. Is that correct?
Okay, now, Dr. Sharma, you won't be interrupted. You've got 2.5 minutes to answer the question.
you.
And that is the last question.
Thank you. So
from Mr.
respectfully,
Doherty.
Chair, I'm a pediatrician. That's how I was trained to look after children. I don't think there's anything more tragic than the loss of a child, and I don't think any parents should have to live through that, and I'm sure that these parents very much love their child. That was not the intent. The intent in the discussion that we're having is that if you have natural health products that are making claims against serious diseases, and people believe that they may be using those treatments instead of using treatments that could potentially help their own condition or that of their loved ones. That was really the context. And the context is that, for example, the other example was a physician that said that one of their patients was taken off their medications and put on a natural health product for seizures and had tragic consequences. So it was just in the context of that. I don't want to cast any aspersions on any parents. It's just that when products are being misrepresented, then there can be consequences, and it's
Point of
not
order, Chair.
just the
Point of order.
toxicity of
Yes,
the
Dr.
product
Ellis.
itself.
I think that what we asked was that there be an answer to the question, not an expansion of it or direction around other things. What the question was very clear was related to the fact that you cannot regulate what parents do to their children. And regulating natural health products would not have made this child live longer if their parents chose to do something different. That answer does not answer that question at all.
I'm sorry, Dr. Ellis, that isn't a point of order, and if you could finish your answer, Dr. Sharma, and then we'll get on with the last round. Go ahead and finish.
Thank you, Chair. I'm done. Thank you.
Mr. Chair, can I ask
Thank you.
a question that just might clarify for everybody?
Well,
if I may-
the last question is going to go over here.
Okay. Well, just on this, I think would help all of us, and Dr. Sharma, in that case, was the product that was given, did it make a claim that it would treat the particular ailment that the child had?
So we don't have the details, but the understanding was that the parents believed that it could treat the condition that the child had.
Okay.